Hey everybody, Dr. Ryan Weaver here again for our second wellness workshop titled Spinal Strengthening, Proper Spinal Strengthening Exercises. This is going to be unlike anyone we've done before, referring to the same topic. So we're going to dive into this. We're going to roll right in to this from our previous one, which was goal setting. Again, that is up on our YouTube channel. And just a reminder, here in January, these we're all doing on our YouTube channel. Starting in February, anybody in the community, not just our patients, is welcome to join for these live here at our office. So, spinal strengthening. I get this question a lot. Aside from adjusting, aside from a few of the other modalities that we do in our office, what are things that patients can give out here? And one of my opening statements to our patients is, if we don't change behavior, or if we don't change what got you here in the first place, no matter how good your doctor is, how good your chiropractor is, how good your physical therapist is, until we change behaviors, we don't see long-term outcomes. It's the pure definition of insanity. If you continue to do the same things you've always done, you're going to get the same results. So, going right into this, strength and strain. I love exercise. I love working out. It's been pretty much my entire life, from high school sports into the degree I had in undergrad. And one of the questions, again, that patients often ask, exercise and workout, especially this time of the year, beginning of January, New Year's resolutions. So I agree with strengthening, and I agree with stability before power. Okay, we'll get to the power part here in just a few moments. But we need to know also, what are we working with? What deficits do we have? What weaknesses do we have? Why we x-ray in our office, so we can see the condition of the spine. The amount of patients who I've seen who have abnormal curves or scoliosis or a lot of dysfunction in their spine, there are certain things that we should and should not be doing. And without knowing that, we're essentially guessing. So what I've noticed, most back pain isn't just from a weakness alone, but when we look at coordination and actually spinal stability, we start to see the parts of the puzzle and parts of the chessboard get put together on why exactly we're having back pain. And the spine itself, again, most people think chiropractic just deals with the spine, but we deal with a lot of other joints and areas of the body than just the spine. But to move and be protected is what it's designed for. So I have a lot of good slides on here, a lot of little fun facts like this tent pole analogy, which I love. But again, if you think about it, if you're building a tent, your tent pole is like the spine. Obviously that is strong itself, but without the guide wires, it'll collapse. So we have to have proper strength and support around our spine itself. Now, when I say that, and again, I'm preferencing this, is you hear, I need to strengthen my lower back, or I need to strengthen my core. I need to strengthen my core. I need to strengthen my core. We're going to dive into that. So we're going to show you the muscles that matter, the exercises that are best for it, and also ones to avoid. There's definitely one that I really push to avoiding. Again, I think it gets done a lot before you've talked to a professional. And again, I'm going to preference this too, is again, whether you're one of our patients or maybe you're a community member or somebody else tuning into this, again, unless we've actually done an analysis, a movement screening, any kind of screening on you, again, tread that with caution because I don't know exactly your situation. So our 3 jobs of our spine: protect, move, and support. I couldn't say it any better than this. Number 1, protecting our spinal cord and our nerves. So some fun facts for you. Again, when we talk about movement and mobility, there are 24 movable segments in the spine, but back up here, I think this is the one that gets left out a lot, and we talk about a lot in our office, is protecting our spinal cord and nerves. Bone itself is extremely strong. When you look at the spine, what I've seen in the research is that it can support up to 2,000 pounds of pressure. So when you look at, we use the diagram up here, but when you look at the spine, and we know that the spinal cord runs down the center, in our body, our skull and our spine are the only things that are totally encapsulating our nerves and our nervous system, our central nervous system. So our brain and spinal cord are totally covered by bone. It's basically armor. Our internal organs obviously extremely important. Our rib cage, that's very easy to crack and break. And when you look at half of our internal organs are totally exposed. Your kidneys have zero protection back here, essentially. So protection is number one. Number two, moving, bending, twisting, rotating. One of the things I always talk about, I feel like I'm always trying to fight a water bottle that is behind me in my vehicle, and I'm trying to locate that. There's a lot of movement. There's twisting, there's lateral bending, there's rotating, a ton of movement. And with all those movable segments, we're super mobile, but that does make it easy to injure. And number three, it supports, it helps, like the tent pole, again, that helps keep us upright. So when you think of our muscles and we think of deep muscles, the deep muscles are the ones that usually get often missed. We talk about, your abdominals, your quadratus lumborum, a lot of the big muscles, but we rarely talk about stability and all the little muscles that play such a huge role in our spinal health. So if we skip stability and we go right to movement or right to power type of movements in the gym, I usually do see patients who have pain. So the core, our abs, again, we're generally going to call these our abs. Again, we can get into obliques and other parts of those. But if you think about it, our deep ab muscles act as a back brace. The muscles along our spine act as posture control. Our glutes themselves, huge supporters. You think about all the big muscles in our lower body that helps to keep us upright and support us. And then, again, a huge one that gets left out is our diaphragm and breathing exercises and stability. Again, a strong spine starts with control. It is not a crutch. Our principles. So with this, and before we start getting into our exercises themselves, which will support you, we're going to show you those on a second video. This is just kind of the overview. Our second video to follow this will just actually have us demonstrating those. Our 5 principles. Number 1, neutral first. We've got to be able to train neutral. We've got to be able to strengthen neutral before we get into all the other movements. Then number 2, slow beats fast. So big pause. If you listen to goal setting, again, and I led with this today, is exercising. I've done all types of competitions, all types of exercise. And one of the things I'm currently doing now is a lot more time-controlled reps in the exercises that I do. What I have noticed now is I do feel the second or third time, throughout this duration, weeks and months, what I've noticed, not only the strength increase, but the actual overall stability when doing something like a bench press or doing something like a deadlift or a back squat. So there are certain times to use power and there are certain times to actually have a slow and controlled rep. Number 3, quality over quantity. Again, to me, number 2 and number 3 play really well off each other. I would rather do less repetitions and slow and controlled and actually get a higher quality of a rep. Number 4, pain. So obviously we're talking about sharp pains and other pains versus just the general soreness from working out and exercising. Those things are normal. And number 5, consistency wins. Just like we talked about goal setting last week, consistency, changing behaviors. All right? Just like we always talk about, you can't overtrain a bad diet. Being consistent in all of these things, health related, are what matters. It's compounding interest. So that when we do hit our 40s, our 50s, our 60s, our 70s, we're not trying to put out all these fires that I see patients come in our office with. Well, I've never had back pain. In my 20s and 30s and 40s, I never had that. And then they show up in our 50s and 60s, and we're dealing with all these issues. If you invest in your health now, it will pay you dividends in the future. So, small daily work versus being heroic and doing all these all or nothing things, being consistent and changing behavior. In a moment, we're going to go over, I believe I have 5 on here, diaphragmatic breathing, modified dead bug, our bird dog, glute bridge, side plank. A lot of these we've actually shown in a few previous videos, and there are some more new ones. So, breathing, we're going to be talking about actually belly breathing and working that, then breathing with our upper ribs and our chest. Number 2, or B here, our modified dead bug. Again, we're going to see a lot going into coordination and balance and slow movements. Bird dog, this is one of my favorites. We do this often and show this often. To me, again, keeping our spine neutral and really getting that coordination through our entire posterior chain. Glute bridge, the same thing. Activating our glutes and our lower back. And the side plank there, again, dealing a lot with our core. So, common mistakes that I see, we think that we have to increase the strength in our core. So I have a lot of people who go to sit-ups. Heavy lifting here. Again, when a lot of people, to me, and what I hear in feedback is, well, if I'm going to strengthen my lower back, we should do a lot of deadlifts and things like that. I do love deadlifts. I love a lot of those lifts, but it doesn't necessarily need to be heavy, especially when you're starting with back pain. So with that being said, depending on your experience level, as I mentioned, depending on where you are, again, whether you're a patient or not of ours, I can and cannot give you certain recommendations since I don't know. So take these again until you speak with a healthcare professional. Twisting exercises. To me, I do a very minimal amount of twisting things. For me, in case there is any inflammation or if you have already an inflamed injury to the disc or to your lower back, for example, because we don't want to put any of that stress on the joint. So huge one in today's age is social media, all these workouts. Well, again, without assessing where you are and what your goals are and your specific level of health, be careful with those. Again, I just mentioned this in the previous slide, exercising through pain. So pain, again, can and cannot be an indicator. Again, soreness to me is a normal thing, but you shouldn't be experiencing excruciating pain. So how does that affect us as chiropractors and our patients? So adjustments, we do help improve motion and the mobility in the spine and proper movement along with the nerve communication. Exercises obviously help hold our spine and our joints in place, and they allow us to be able to do different movements throughout the day and varying activities. Again, whether you are just getting involved in exercise or whether you're the most experienced athlete. When we put these together long term, again, when we talk about consistency and our long-term results, what I have seen work best is when you pair these together. Again, you can get results with this, you can get results with this. When we pair them, it just helps everything out in the long run. Again, I love this down here. We don't want you just to feel better. We actually want to see you elevate your health and stay better longer. So if you've been unsure what exercises to use with your spine or to use and are safe for your spine, that's exactly what we do to help. When we have patients start in our office, we always go over stretches and exercises for them to do, specific to their exam and their x-rays. Everyone's spine's different, and again, as we notice, sometimes we have to make, no pun intended, adjustments to that individual. So, coming on the next video, you're actually going to see us demonstrate those exercises and stretches to do on that second video. Again, reps, time, all those things can kind of vary. That would be specific to you. All right, guys, this is our diaphragmatic breathing. So you can do this seated, you can do it laying down. In this example, obviously we're gonna do it seated with Dr. Jake here. So I want you to think of belly breathing with this. So keep your upper body, shoulders, upper chest, and ribs neutral, and try not to move those. Naturally, when some people breathe in, they want to take a deep breath in with their chest, and then out. For this one, think about just moving your breath through your lower stomach. So if you think about that, what you can do is put one hand on the bottom or just underneath the bottom rib. You're going to breathe in 4 seconds, slow and controlled. Try to move your hand with your stomach. When you exhale, do a 6 count. So in 4 count, exhale 6 count. Now, with that, you can do this up to 5 to 10 minutes. A few of the advantage: lowers heart rate, helps oxygenate our blood, which essentially is being helped because we're stimulating the parasympathetic nervous system. What in the world is that? Parasympathetic, think slow, yoga, calmness, peace, versus your sympathetic, which is, hey, we're down by 3 points, we've got 10 seconds left in the game, we've got to score a touchdown, everything's heightened and aware. So that is one that we're going to target. All right, that wraps up diaphragmatic breathing. From here, we're going to go into what's called our modified dead bug. So I'm going to have Dr. Jake lay on his back. All right, so we're going to go 90-90 position here. We're going to go hands straight up, palms facing each other. Excellent. Now, we're going to bring our lower extremity up, both legs. You're going to kind of go in that reverse tabletop. I want you to bend at 90 degrees here. You're going to bend this one at 90 degrees. All right, very good. So we're going to work lower half first. What I want him to do is we want to keep our lumbar curve. We want to engage the core here, so our abdominals. Now, what he's not doing is pushing his abs so tight that it's flattening out his lumbar curve. We're basically just not letting that rise or lower, just keep it neutral. With that, I want him to use one leg at a time. He's going to think of bringing this leg down, touching the heel, and back up. We're going to do the other, and back up, slow and controlled. And as he does that and performs this, we're going to keep that core engaged. Very good. Back to here. Now, we can do one at a time with our upper arms too. We're going to go back, up overhead, slow and controlled. Same thing. We're going to go same thing there. Very good. And you're just going to repeat this. Good. Go ahead and relax there for me. So, our next that we're going to do what we call bird dog. So we're going to lay, basically reverse this. We're going to be on all fours. Again, think of that 90-90 position. We're going to go 90-90, and again, what we're referring to is 90 degrees with our shoulder to our upper torso, lower torso, and our upper leg. So think about keeping a tabletop through here. If I set a glass of water right here, that should not move. So, kind of opposite of what we just did. We are going to go one arm to the opposite lower. We're going to extend that out. We're going to do them both at the same time. Extend that leg back. Good. We're keeping that tabletop because what we don't want to do is we don't want to go this way. We don't want to go that way. We're going to go back to neutral. Slow and controlled. Slowly the opposite. Slow and controlled. And then you'll continue to exchange with this. Again, try not to rise one side or the other. Very good. So that is our bird dog. Next, we're going to go back into a laying on our back position. So this is called our glute bridge. So what we're going to do, we're going to bring both legs up, feet flat from here. You are going to drive your hips up through the ceiling, squeezing the glutes, squeezing the lower back. You can hold, slow and controlled. So again, as I mentioned in the previous video, we're slowly and with control executing this exercise. All right, you can drive through the heels with this, and again, you're going to bring that up through. This is activating our glutes and unloading our lower back. Good. Go ahead and relax. All right, our last one. This is going to be a side plank, so I'm going to have Dr. Jake lay on his side. There are a few modifications with this. So we're going to start with knees down first. This is more of a beginner, and you can do two things up here. One, if you notice, he's going to his elbow. You're going to make a wide base with your forearm. You're gonna push off of the elbow. You're gonna bring your hips up through. Very good. You're gonna hold that. You're gonna try to keep the spine straight, keep up through here, and you're holding that core. Okay, you can go ahead and relax. And you can do reps with that. Maybe he held it for 5 seconds, 10 seconds, and relaxed, and go back. You can try to do that as long as you want. That was the beginner part. If you want to go all the way where you're actually balancing, and this table might be a little small, Dr. Jake's taller, going off of your foot and then going up, so you're going to get the lower leg more off than when you had the knee down. And up and relax. Very good. Go ahead and relax. So those are 5 of the foundational spinal strength exercises that we like to teach and that we like to do. I hope this helped you guys out. As I said in the previous video, time, reps, how many, how often, that's purely dependent on your basically weaknesses or what we need to focus on the most. So again, whether you're a patient in our office, ask us. If you're not a patient in our office and want to be, feel free to give us a call, and we'll be happy to do any of those screenings with you. Thanks, guys. So hope you enjoyed this video. Next week, we're going to dive into diet. We're not going to be talking about any fad diets. We may mention them, but we're really going to talk again about changing the behavior so we get the best results throughout our life, not just this first quarter of 2026. Thanks, guys.